A very good evening to you, and thank you very much for tuning into Metropole TV. Thursdays are for Metropole Debrief, and tonight on the show, we get to have a sit-down with two phenomenal women and discuss the cancer scourge in Kenya. Who are my guests tonight? Dr. Catherine Nyongesa Wata, an oncologist at Kenyatta National Hospital and the founder of Texas Cancer Center, joined by also Honorable Gladys Wanga, who's the women representative, Homa Bay County, and she has a bill that she's proposing amendments to, and we'll be getting into that in the second part of the conversation. But right about now, we want to lay some numbers and figures into perspective so when we get into the conversation, you have an idea of what we are talking about. Now, globally, today, we will be talking about the cancer pandemic in Kenya, or rather the cancer scourge and what is going on in this country. Now, globally, cancer causes more deaths than HIV and AIDS, TB, and malaria combined. 70% of the global cancer burden is in low and middle income countries. And in Kenya, the cancer is the third largest killer disease in this country. Now, 60% of Kenyans are affected by cancer are younger than 70 years old. The annual incidences are estimated to be about 37,000 new cases, with the annual mortality rate going up to about 28,000 people on a yearly basis. Now, all this is according to a survey that was done by Farley et al. In 2013. Now, in Kenya, the risk of getting cancer before the age of 75 years is 14%, while the risk of dying from cancer is estimated to be at 12%. According to International Agency Research on Cancer, WHO, the annual number of men who have rather lost the battle to cancer in 2018 stood at 14,215 men, women 18,772, making the total number of people who've succumbed to this disease 32,987 people. Now, the new cases reported among the men stood at 19,199. Females stood at 28,688, making the total 47,887. Now, let's take a look at the most reported types of cancer. And among the women, it's at the most reported cancers include breast cancer, cervix cancer, and uterine cancer. Among men, it's prostate cancer, esophageal, and colorectal. Now, in every 100,000 women, 34 are diagnosed by breast cancer, and in every 100,000 women, 25 are diagnosed with cervical cancer. Now, these are just statistics from the World Health Organization. Although cancer is a curable disease, unfortunately, 70 to 80% of those diagnosed with cancer in Kenya are at an advanced stage due to incidences of maybe misdiagnosis, inadequate screening, hindering early detection due to lack of awareness, inadequate diagnostic facilities, lack of treatment facilities, high cost of treatment, high poverty index, among reasons that we could go on and on and on. Now, in 2012, there were about 20,000 new cases reported, but the number has since risen to 40,000 annually. Now, this is in spite of the grim numbers. The government remains unmoved in its war against the disease that ranks third in the list of top killers in the country. This makes cancer treatment extremely expensive, and it implies that 90% of Kenyans cannot be able to afford this treatment. This explains why the mortality rate has risen from about 20,000 to 40,000. Now, cancer treatment in this country is very high. It is estimated that 15% of the low-income countries receive 5% of the global spending on cancer, thus forcing patients to fully fund the expense. Now, approximately, how much would it cost you to treat these diseases? On an average basis, treating cervical cancer in Kenya without surgery would averagely cost you between 172,000 to 759,000 thousand Kenya shillings. If you're going through a surgery, it will cost you between 672,000 Kenya shillings to 1.25 million Kenya shillings. Now, this is according to researchers affiliated to the National Cancer Control Program at the National Cancer Institute of Kenya. Now, patients seeking basic treatment for breast cancer pay roughly between 175,200 to 1.98 million Kenya shillings. When surgery is involved, you'll pay between 758,000 to 2.48 million. And these are just on an average basis. Different hospitals charge different amounts, which would either be maybe you're going for a lumpectomy, quadrantomy, partial mastectomy, or a segmental mastectomy. Now, treating prostate cancer in Kenya, let's take a look at how much it would cost you to treat prostate cancer. On an average, without surgery, 138,000 to 1.21. That's for prostate cancer. For esophageal cancer, it would cost you between 1 million Kenya shillings, 126,000 to 1 million Kenya shillings. That's how much it would cost. Now, governments across the world are being faced by this challenge of the disease that is cancer. Previously, it has been malaria, HIV, TB, but now governments are trying to find ways of dealing and eradicating cancer in their countries. And Australia is one of those governments where the government began exploring options, and these options are preventive options. Now, each year, cervical cancer affects over 500,000 people around the world, with one person dying of the disease in every 2 minutes. Now, Australia, as you can see here, is seeking to become the very first country in the world to wipe out cervical cancer. And this is thanks to the national vaccination and screening and programs which could see the disease effectively eliminated as public health issue within the next 20 years. Now, if we roll back, 20 years looks like a long time, but it's not, because Australia began this project in the year 2007, a national public funded school immunization program for a vaccine to tackle the human papilloma virus, popularly known as HPV. Now, new research published in the Lancet Public Health forecast the disease will soon be a rarity in Australia, with fewer than 6 new cases reported per 100,000 women by the year 2022, and fewer than 4 cases reported between 100,000 women by the year 2035. However, that's Australia. In Kenya, day in, day out, we lose people. Unknown to most, 70 people die every day. These are people that we might not know, but they're dying every day. But also recently, we've seen people that we know and people that hold position of leadership in this country succumb to this disease. And some of those people include, most recently today, there was a requiem mass for the late Bomet Governor, Honorable Joyce Laboso. Last month, Safaricom lost its CEO, Bob Collymore, and also Kibra lost its Member of Parliament, Ken Okoth, to cancer. Now, as much as this is a really sad time, it's calling for conversation. And that's why after the break, I am joined by 2 amazing women to have this conversation around cancer and try to find what is the way forward. See you after the break.